Yeah. No, I will. Hi, everybody, and welcome. I'm Reed Alexander, and I'm so pleased to have you here this evening on the Facebook Live channel of Retreat Behavioral Health. And it is Thursday. It is the 23rd of June, and we're coming to you live from Palm Springs, Florida, the headquarters of Retreat Behavioral Health, for a really important conversation this hour about fentanyl and fentanyl awareness. This has quickly emerged as one of the most threatening scourges to young people and families in our country. And as a journalist, I'm deeply concerned about the prevalence of fentanyl, which quite literally could be in substances that you might have a loved one who was in a nightclub this weekend, could have been there. And that's not to incite fear. It's to really just tell you how widespread the nature of this substance is. So over the next 40 minutes, we want to give you a preview. So you might hear some background noise. We've got a lot of people coming here to Retreat Behavioral Health tonight for a really fascinating conversation. We're going to have a panel, including Marlyse Williams, who's sitting to my left. We're going to be hearing from parents who tragically have lost children to fentanyl poisoning. We're going to be hearing from a clinician, Liza Piekarsky, this hour, who's going to answer some questions. But what we're doing at Retreat is we're partnering with the Fentanyl Awareness Coalition. This is an important group that's doing important work to raise awareness for this rapidly devolving threat. And we're going to be talking about that and raising money for a great cause. So we thought ahead of time, why not invite you to the table? We wish you could be here with us, but we wanted to invite you to the table so that you could be a part of this evening's important events. So let's get into this thing. I figure over the next 35 minutes with my two guests here, we're going to ask some questions about the impact of, I'm cautious to say, I used to say substance use when I worked at Retreat, you know that, but this isn't just about substance use or abuse. This is about something that is so lethal that quite literally if you touch it, it could be fatal. I mean, this is unbelievable. So what I want my guests to do is introduce themselves to all of you, our viewers, and hopefully you'll send in some questions during the live as well. So why don't we start with you, Marlyse Williams? Why don't you tell us about yourself? You have a very poignant reason for being here, but you've taken a painful situation and you're trying to do some very important work. So Marlyse Williams, why don't you introduce yourself to our Retreat Behavioral Health community?
Thank you, Reed. My name is Marlyse Williams, and my only child, Logan Williams, died April 2nd, 2020, and he was actually an actor, and he played the young Barry Allen on The Flash, and so it really created a lot of people were interested in how my son died, and when the coroner came out with the fact that he died of pure fentanyl poisoning, I, of course, immersed myself with what's going on, how is this fentanyl coming about, and then I learned that it is the number one cause of death under the age of 50, over cancer, over every other illness, homicide, suicide, you name it, and more people are dying of fentanyl poisoning in North America than anywhere, anything else. So that is frightening.
I mean, that is a very telling statistic indeed. So your son, Logan, passed away in 2020.
That's correct.
So at what point in the year? Early on in the pandemic or? Yeah.
Yeah, April 2nd, so it was right at the beginning, which was also horrific because we couldn't grieve properly. You know, we weren't allowed, especially I'm Canadian and Logan was Canadian, and we are based out in Vancouver, and so it was really horrific as a single mom. We weren't even allowed to have a proper funeral, and I felt that was just, it was just so tragic and so on so many levels, of course.
Yeah, no, it's a really tragic loss, and obviously we're sorry for your loss, and I want to hear how you've managed in 2 years to get to this place of certainly outwardly resilience and try to do some good work so that you could save other children. But I want to bring in Liza Piekarsky as well. Liza, you are a licensed mental health counselor. You've done a lot of work. We know each other well. You've done a lot of work with trauma survivors and young people. You specialize in adolescents. Tell us a little bit about your practice, and also how much of a growing threat you see that fentanyl is becoming here in our community in Florida and nationwide as you talk to kids and families.
Yeah, so thank you so much for having me. This is such an important topic, and I think it's amazing that we have such a big turnout for everybody to learn a little bit more on the severity of fentanyl, not just being a substance use concern. I am a licensed mental health counselor and also a certified addictions professional, so I solely focus on, or mostly focus on, adolescents struggling with substance use. And again, like we're seeing right now, my practice is full of clients that are coming in that aren't necessarily struggling with substance use, but more so self-esteem, going to parties, showing up, trying new things as different drug trends are starting to appear. So I think it's really so important that we're educating not only the community, the parents, educators on this growing trend that we're seeing right now.
Yeah, it might be easiest. Feel free to grab the mic from me. I know we only have one microphone, but it may be easiest for that. But I want to ask you, Liza, how much has the pandemic fueled, in your view, a rise in consumption of substances? I mean, obviously, we've seen in the past year record numbers from the CDC in terms of overdose deaths, as you know, and I think a lot of that is fueled by fentanyl. But thinking about the factors that are leading people to turn to substances, how much in your practice do you see that the coronavirus pandemic and all of the difficulty we've been through in the past 2 years is fanning the flames of this substance use? Here, I'll hand you the mic.
Yeah, I don't have the specific numbers, but I can say that we've seen a huge influx of clients coming in struggling with substance use. When the pandemic hit and it was that social distancing, being physically distant, we saw a lot of isolating in teenagers, young adults. And what happens when we're isolating in our prime years? We're looking to find some connection in other ways. You mentioned with, significant loss and trauma, that grief, when we're not able to grieve outward or with others and we tend to grieve inward, we turn to things that help us, either suppress our feelings or allow us to experience these feelings that we might not feel comfortable expressing in the moment. So
yeah, I think we've seen a significant increase, and I don't have the exact data either. I don't know that the data is known yet. Some of those numbers are still in flux, but certainly in my conversations as a reporter covering this, we've talked to clinicians and psychiatrists who do see an increase in alcohol use and alcohol consumption and other kinds of substances. But I think what is so insidious about fentanyl is you don't have to develop a dependence on this to really see your life ruined or destroyed or your family torn apart. I mean, I guess, Marlyse, it would be interesting to know, to the extent you're comfortable, share with us, tell us about your son. Why don't you start by telling us about Logan? And then we'll get into, obviously, what factors conspired to this tragic end. But clearly he lived a life of consequence. He was on the flash. Tell us about your son.
Thank you, Reed. Well, Logan was obviously a very charismatic, bright, spirited boy, and he of course was very talented as well, and he lived his life to the fullest, that's for sure. And unfortunately, Logan suffered a significant trauma at around 12, and that's when I noticed a huge difference in his demeanor, and that's when he started smoking pot, and things just started spiraling out of control. So my son is not a story of one pill, one time. However, had he done exactly the same thing pre-2013, pre-fentanyl on the streets, he'd be alive today. So he never got that chance. So I'm not saying that Logan was perfect in any way. He was perfect to me. But he unfortunately struggled with a lot of pain, and he tried to, like Liza said, he used drugs to handle that pain, and unfortunately, that's right. And unfortunately, he got a pill that had pure fentanyl in, unknowingly, of course.
Do you know how he got the pill?
I don't know.
Yeah. So take me back to the day that you learned this tragic news. Where were you? Walk me through the scene. I'm sorry to subject you to sort of opening old wounds, but I think there's real value in helping break down stigma and shame. You and I were earlier talking about shame. Take me back to that day.
Well, so what I remember of it, because Logan was not at my house at the time, and then in the morning I got a text from his girlfriend saying, "Is it true?" And I said, "Is what true?" And she said that Logan's dead. And then I phoned where he was at right away, and yes, it was true that he had died at around 4 a.m. And
What was your reaction?
I honestly fainted. And so in the initial shock of losing a child, I actually always tell parents, regardless of how you lose your child, I run a grief group, and I always say losing a child is like a heroic journey of survival, because every day it changes. And but after this initial horrific grief and that acute grief, I of course immersed myself with learning everything about fentanyl, and I could not believe how it's just saturated in every little pill, whether it's ecstasy, Percocet, Xanax, cocaine, you name it, it's in there, and it's actually in upwards of 82% of all drugs. So you think and these kids are ordering this on Snapchat. They are ordering this on social media. It is so scary, and parents need to know this. And so that's basically how I've evolved into I can't save Logan. I will never, ever get to be with him again until it's my time. However, I can save other Logans or any other, hopefully, other people. That's my mission.
No, I mean, I appreciate your honesty, and I want to come back to you. But, look, what Marlyse brings up here is a very important point, Liza. We have a lot of young people dealing with a lot of pain. 3 years ago, you and I sat on this stage, and we had an event about adolescent mental well-being and mental health. And as you recall, we heard from a lot of people in the audience. I mean, we obviously will have a different audience tonight of advocates and activists. But 3 years ago, we heard from a lot of people in our area who spoke openly about enduring trauma. Marlyse talks about her son having endured a trauma when he was 12, and we know that enduring trauma can incentivize people to turn to substances to help cope. First of all, walk me through that. Do you find among your younger patients, is there an inclination to turn to marijuana or other kinds of substances to help cope with grief or trauma or anxiety or other kinds of mental health issues they're facing?
I think there's not a one-size-fits-all. If a child is predisposed to things, there might be an increased chance that they will turn to substance use. Depends on their support systems, right? There's a lot of factors that we have to take into consideration. So I don't want to say trauma equals substance use. But there is a higher rate of substance use for those who are suffering from trauma. There's definitely a correlation, yes.
To that end, we know there's a correlation, right? Many people, we want to be clear, do endure trauma and don't turn to substances as a coping mechanism. But we do know there's a relationship there. How concerned are you hearing parents are when they talk to you about fentanyl? Are they concerned that their children or, loved ones may be turning to substances, and now there's this insidious killer out there that you really can't test for, you really can't predict? Are you hearing concerns from parents in the community?
The interesting thing is, no. I'm hearing from the community and from, yet not necessarily from families when we're having these discussions and educating them on fentanyl. They're really not aware of it. They understand more so fentanyl as prescribed in hospitals under a pain management setting, not the illicitly manufactured fentanyl that is being squirted onto, different things throughout, the drugs that the teenagers are using. So no, it's not really. It's pretty much news to them. Not all, of course, but it's not something that's being discussed in this heightened awareness or concern yet.
Yeah, Liza, thank you. I want to remind our viewers, if you're just joining us this hour, I'm Rita Alexander alongside Marlyse Williams and Liza Piekarsky here at Retreat Behavioral Health in Palm Springs in Palm Beach County in Florida. And, we want to welcome you this hour as we count down to an important event that we're looking forward to hosting tonight. It begins at 6 o'clock sharp, but we wanted to do a pre-show to have you part of this conversation. We're working with the Fentanyl Awareness Coalition tonight. We've got a panel in store and a number of discussions with public and private officials to talk about the widespread threat that fentanyl is rapidly becoming in our community and what can be done to stop it. So, Marlyse Williams, you were bravely telling us about the tragic passing of your son Logan as a result of fentanyl at age 16 2 years ago. You just heard Liza Piekarsky, a clinician in our community, say that she's not yet observing an uptick in concern among families or a realization that there's an urgency here. What does that say to you as a parent who directly has experienced grief and loss as a result of this?
It scares the heck out of me. And I always say to people, don't say it couldn't happen to me. It wouldn't happen to my kid, because it can happen. I always tell people, I'm literally your worst nightmare. And they go, what do you mean? I said, because you could be me. If it can happen to me and my family, it could happen to anyone. So no one is safe. It doesn't matter what race, it doesn't matter the age, it doesn't matter what sex, it doesn't matter if it's a two-parent or single parent, it doesn't matter if they were in sports or no sports. It can happen. And I think the biggest point is the accessibility. It's so easy to access that it's easier to get a contaminated pill than it is to get a drink of a beer. And that's frightening.
Yeah, thank you so much for that. Look, I'm understanding there are some interesting questions coming in on Facebook Live, which is great to hear. And I'm going to check and see what our audience is asking right now. So, we're hearing from viewers. We want to remind you, we've got about 25 more minutes with our guests. So ask questions. We've got Liza Piekarsky as a clinician. Marlyse Williams is working with the Fentanyl Awareness Coalition and has directly experienced a tragedy with her son passing away 2 years ago. So, Marlyse, this is a great one for you to start with. And then, Liza, we're going to bring you in on this. A member of our community has asked, how do you find a grief group? And you've mentioned that you actually founded a grief group. How did you immediately do that, or did you first join another group and then decide to start your own? Give us a little bit of the backstory and then share advice with our community on how to actually go about finding a grief group where they can find others to help share the burden of some of this trauma.
That's a really great question. So I did start one off. Keep in mind it was during COVID, so I started one in my own home because at that time Canadians were extremely strict about COVID, and we weren't allowed to have people. Right. Of course. So it was very strict. So I started one in my own home, and then I slowly found it's a local Canadian group called Moms Stop the Harm, and it's called Healing Hearts. So I joined that one, and now I run it. And unfortunately, what's so sad, Reed, is I just had some parents come in, and they just lost their 12-year-old to fentanyl poisoning. And unfortunately, this boy was a straight A student, a great kid, and he was a skateboarder, and he had some anxiety about a test, and his sister gave him a pill, the older sister, and he was dead in the bed when the parents went never took a pill before. So this is happening, and I think people don't want to talk about it because of the shame. But back to the question, I think it's important to look at other, like Fentanyl Awareness Coalition and other groups of substance use disorder, of deaths, grief groups. Google grief groups locally, because I think it's important to have that support when you've lost someone.
Yeah. No, I mean, there's a lot to unpack there. We're going to come back to this anecdote. You've shared a really disturbing anecdote of a case of someone who sounds like they were never using substances and then happened to be very unfortunate to take a pill that was laced with fentanyl, which underscores just how widespread this is really becoming. I think a lot of people, as Marlyse says, probably think this would never happen to me, and then their lives are upended. But Liza Piekarsky, you've led grief groups. You led a teachers group, in fact, at Marjorie Stoneman Douglas High School, which, of course, was the high school that you and I know there was a mass shooting 4 years ago, and 17 people were killed, 17 wounded. And you rushed into the fray, into the breach in that community to get teachers together, to talk through some of the trauma they were experiencing. So you've got a lot of experience with organizing or with identifying grief groups. Point blank, how do you find one?
I think it depends on what you're looking for. A grief group versus support group. A support group doesn't necessarily have to be run by a licensed clinician or a mental health professional. It could be a mother, an advocate, that would be a support group. And then if you're running a grief group, you can find them. It depends. I had created a whole list when we did the panel, and then also during COVID, I had created a list and come up with a bunch of resources depending if you're looking for adolescent youth groups, parents, caregivers. So reaching out to local agencies. You have 211. There's so many different opportunities to reach out and find local support groups on where you're located. If you want, of course, now we have access to so much more. Being with COVID, that we're able to do telehealth, so there are access to so many more in the community than just showing. There's Gilda's group, depending that's more so for cancer survivors. So there is a significant amount of support groups and grief groups out there.
Thanks for that, Liza. Right, there are resources available, and in fact, I think one of those resources for people locally could be Retreat. You know, we've got 3 large sites here, right? Palm Beach County, and we have New Haven, Connecticut, and as you all know, we're in Lancaster County in Pennsylvania. And I think we want to be a community resource. You know, in my time when I was working at Retreat, one thing that we really prided ourselves on was being a community resource. And I guess we would refer people to our website, you know, to learn more and to reach out to us, and we'll try and help people, even if we're not in the community where they are, identify a resource or a treatment provider that could be helpful to them. So they can head to retreatbehavioralhealth.com, right, to learn more information. But Marlyse, I'm curious, so you founded this organization, this grief group, and in those early days, how did you start identifying other people, to come to this grief group? You founded it in your home. How easy was it? Because I would think if it was easy to find people, that's a scary thing. That underscores how many people have been affected by this.
Yes, you bring up such a good point. Actually, it was so sad. It's all word of mouth. People would say, "Oh, my friend's lost her son. Let me give you her number." And that's kind of how it came about until I joined the Healing Hearts one. And now, of course, it's on our Facebook, etc. And so that's how people can find us. But every week are new people joining, which means someone died of so I almost don't want new members, because it's so horrific to know that another person has lost a loved one to this horrific fentanyl killer.
It's not a disease, right? We can't call it a disease. It's like a substance that, as you say, is a killer. You know, how has your life changed? Do you have other kids? No. This was your only son. That's a very serious thing. How has your life changed since the tragic loss of your son?
Well, there's some dark days, I'm going to be honest with you. Thank God I have really nice and lovely parents and a wonderful support group. I have great friends. And of course, I was so honored to join FAC, Fentanyl Awareness Coalition. And they really heard me, and we have come together, and it's so amazing to shoot ideas and figure out how can we help this unsuspecting parent or teen or whoever. Well, it doesn't matter if they're a first time or someone that is using substance, they all can be affected by this killer, and it is a killer. It's a massacre against our youth, in my opinion.
Yeah, absolutely. So, Liza, take us inside a grief group, because clearly that was a question people are interested in. How does that work? You know, you bring people together who have suffered terrible loss. You know, how, from a clinical perspective, are you advancing the conversation? Because I imagine that a group like that can be very powerful and beneficial, but could also probably present some problems around re-traumatizing or being irresponsible in sort of how you moderate the conversation to make sure people are moving toward a place of healing, even if they don't recognize it or it feels very incremental. But I would think you'd want to be moving people in a delicate position toward a place of healing than a place of devolution and pain. So take me inside how you lead a grief group, particularly for people who have lost loved ones to drugs or illicit substances.
So I think the first I think the first thing, with the most important thing, is that they know that they're not alone, right? When somebody's joining and entering a grief group, you know that you're going to be in a room with people who have not necessarily shared the same experience, but have walked down similar paths. And so you know that you're not alone, right? That just group cohesion and recognizing that I am in a place where it's not just me. Other people are experiencing the similar situations. And then I think it's important to set boundaries, right? Setting group rules and making sure that there's no judgments. It's so important that we're not re-traumatizing the clients who are coming in, because that's very often happens. And you'll hear that, and you'll hear experts that solely focus on trauma really touch base on that and how it could be re-traumatized if you're not seeing the right therapist, if you don't have the right person in place and the right credentials to be doing this. So we want to really tread lightly on the group dynamics and the environment.
Yeah, I agree with that. You seemed to respond, when you heard that, Marlyse. Tell me a little bit about why you seemed to react as notably as you did when you heard boundaries.
I love Liza's input. First of all, it's totally true. I think it's very important to create a safe space for people, number one. And then also there does have to be some boundaries and a little bit of rules in order, like, that you're not talking over one another. So everyone can have, so to speak, their time to open up and know that no one's judging you. It stays contained in that room, and we no judgment at all. But I think it's important not to talk one over another. And then again, we try to a grief group. It can't just be. You need to move forward with your grief and evolve. If you don't, it could be very, very damaging, and it takes a lot of effort.
How have you learned to lead your group?
Well, I have to be a good listener. And I also try to support them by often texting or emailing them after as well. I try to let them know that, hey, if you need to talk, I'm here for you. And I feel like I'm so blessed. So many have told me that meant a lot to them, or they share a song with me, or something of that sense, where they just want to show a picture of their child or their loved one. And I think that really kind of sometimes can make people slowly heal. I hate to use the word heal, but
yeah, I mean, it is a matter of healing. It takes a very long time, but it's a matter of healing. You wanted to add something about this.
That just, everybody might enter the group at a different point in their journey, and so it's important to respect that, understand that we know the stages of grief are not linear, and you could be entering in and out of certain ones at different times, whereas your partner in the group might be a little bit more advanced and leaning more towards acceptance, depending on how long ago the trauma happened. So again, that's also a factor to take into consideration when running these groups.
Yeah, thank you for that. Liza, staying with you for a second, how much are you insightful that you could share with us on, fentanyl can come in a lot of different forms, right? It can clearly come in counterfeit drugs. It can be cut into pills. I heard earlier, I think it was you, Marlyse, were telling me now it's shown up in some cases in marijuana. It's out there in a big way. Where is fentanyl? Where could it be, and how prevalent could it theoretically be in our community? Can you share some thoughts with us on that?
Just to be realistic, it could be anywhere. It could be in somebody's pocket in this room, not because they intended to bring it into the room, but because if you have one pill, it's all it takes. And so I don't know the specifics, but I can say that it's everywhere, and we really need to be careful when we're taking any other prescriptions that are not our own. We should not be taking any prescriptions. It's important to educate the families, the students, just law enforcement, everybody, on the importance of that. That one pill, one party, it could be you. This is not the dare to keep off drugs where you crack an egg and you're like, this is your brain on drugs. This is that one pill, one party. Forget about it. It's just, we're in a different place than we were 10, 15, 20 years ago. So
you raise a very good point, Liza, that we are in a different place. And I think what's fascinating is even 3 years ago, when I was working in the behavioral health care space, leading our editorial division at Retreat, we knew about fentanyl. We knew it was out there, but it certainly wasn't out there as prevalently as it is now, or wasn't as talked about. How has this remade the fight against substance use disorders, the battle that you wage every day as a clinician, and now you're helping to wage to try and save other lives? How has the threat of fentanyl remade that fight, or fundamentally rejiggered the nature of it? Because, clearly this is not something that can be solved through an inpatient stay if, as you say, one pill, one party is as lethal as it gets. So how has this remade the work that you guys have to do?
It's now going a lot deeper than the substance use. We're starting at prevention and education. And for when we're talking about fentanyl, that's where it comes in. This is before that substance use, before the addiction. Yes, as we know, there could be, underlying addiction or addiction leading to this. But the reality is it's the prevention. We need prevention and education in order to really combat this right now. And we need all the man strength out there to get this, to get this across to everybody, the severity of it.
Thank you. Would you like to add something to that answer?
I just want to say we have all seen as a country how we can quickly get together when there's a pandemic. And I feel that fentanyl is completely ignored, and we really need to come together to really build awareness. So it's so programmed into a child's mind that when they have that time, hopefully never, but if they ever someone says, hey, do you want to take this pill? It's going to be so programmed in them that they're going to say no. And that is very, very important that we get the word out there. And I wish that that we'd have more help from the government advocating.
What do we need?
That's a multifaceted question, and we have there's so many issues. We need to stop the influx from China making it, and then it's being pressed into the pills from the Mexican cartel. To be honest, that's if you really want to get deep into what's going on. That's what's going on, and then it's purposely and masterfully designed to take out North American youth.
And in your research, have you found any strategies that would be helpful in actually accomplishing that? That's a difficult task.
It's a very difficult task. I mean, for instance, it actually came into the Vancouver port in Canada before it came into the USA because our ports are unchecked. So we have the largest port in Canada, the second largest in North America, and imagine all these huge containers coming in with unchecked. No, we have no port police. So that is scary. And so there's so many points to cover on how to I don't know if we'll ever get rid of fentanyl.
Well, listen, it's clearly out there. When I was covering the Parkland shooting a few years ago and ended up meeting a lot of parents who had lost, children in the shooting tragedy, I was also at the same time reporting for Retreat and, speaking to parents that had lost kids to substance use. And what I distinctly had the impression of for parents who lost their kids to some sort of tragic event was it reshaped their whole purpose in life, and they adopted this new sense of purpose. I want to ask you about finding purpose in the wake of trauma in just a second, but I am curious if you feel that your purpose now, after the tragic passing of your only son, is to do everything you can to save other people's children. It sounds like that's what you've been doing for the past 2 years, but I wonder if you feel it's fundamentally remade, what your mission in life is.
It actually has, and it's like literally been sewn into my fiber, my being of trying to help others. If I can just save one child, then I feel like Logan's death wasn't in vain. So I continue to spread the message, spread the word, and that is my fight. That's Logan's legacy in my eyes.
Yeah, Liza, when people go through tragedy, I find that there are various responses. As you know, there are a spectrum of responses to pain and trauma. One of them is like coalescing around a mission, and being mission driven. How much of a strategy do you see that implemented among those that have lived through trauma? Is it the right strategy? Do people use it as a coping mechanism maybe to bury the pain that they've endured? And how do you make sure that throwing yourself behind activism, you and I remember when we were doing this panel with Parkland survivors, they talked about how getting out there, getting on the road was a way for them to sort of, focus all of the energy they'd been through. But then 6 months later, they kind of crashed and burned and realized that they hadn't invested in the healing they needed to do. Talk to me a little bit about that, about finding focus after tragedy, but being careful not to allow it to drown out the need that you have as a person to get care and to heal.
You bring up such a valid point, and it's important to get, in time of tragedy and hardships, we just reach out to connect, right? Our human nature is to connect and just be part of something and find support. And so being part of these, the coalitions or being part of the Parkland, the groups, it's helpful in the beginning phases, and it's helpful in the long term too. But we want to make sure that you're not fully immersing yourself into that and in a way to suppress the rest of the emotions that you're experiencing, right? And a lot of times we can see that happens as we fully immerse ourselves into something else to help us feel or take away the pain, yet we're really not digging deep in and working through some of that pain. And in initial trauma, avoidance might be important. It's a defense mechanism. It helps protect you from experiencing the feelings and emotions that you might not be ready to experience, but at some time. And that's not up to me or you to decide. It's up to that person to decide that this is, it's time for me to really start to work through some of this deeper grief through it.
Yeah. Thank you for that. I look at you, Marlyse, and you're clearly so passionate about this, but so at peace. You seem at ease. I think Marlyse really seems at peace. And I imagine you said earlier you have difficult days. How did you get within a period of roughly 2 years from losing your only son to the point that you can be here with a room of nearly 300 people having a really thought-provoking conversation, and you can rededicate your life to getting out there and being an advocate and being a defender for other families? How did you get from point A to point B? I'm sort of fascinated by that, because I would imagine 2 years is a blink of an eye for people that have been through the kind of trauma that Marlyse has.
Yeah, I think Liza just diagnosed me. I keep very, very busy. Very, very busy. I have a career as well as doing this volunteer work. So I'm a sales rep for a dental company. And I also run that grief group. And then I'm part of Fentanyl Awareness Coalition. So I'm very, very busy. But I do think I feel that Logan lived such a full life, which sounds kind of strange maybe to someone. He was 16, but he had really done a lot. We traveled all over the world. Tell us about his career. He had a vibrant career. Yeah, so Logan was, we were at a mall one day, and Logan was 10 years old, and a lady from an agent came up to us. She was a casting director from LA, and she said, "Is this your son?" And I'm like, "Yeah." And then she said, "Oh, he's so cute. He should be in the movies. I'm a casting director. I'm just in town for briefly, but anyways," and she said he should get in acting. And then of course Logan heard that, so every day it's like, mom, remember that lady? She thought, and it was on, and he was bugging me. And then finally I gave in. I really didn't want to, but then he got an agent, and then he cast his first audition, and that was for Hallmark movie. And then he landed his second audition, which is almost unheard of, as you know. And that was for When Calls the Heart, which is a series still going on. And then of course The Flash was a very fun experience for Logan. He loved it. He was like, "Mom, this is the greatest." So anyway, so it just escalated from there. And then towards the end of his life, he was auditioning for other film roles and Riverdale. So but our main goal was he wanted to be behind the scenes and be a director. And we actually were writing a script together before he passed. Yes, I am. And I think it could be a great Netflix series. So again, he loved music, so he wrote a lot of a ton of rap music, and thought he was a good singer, but I hate to say this. Sorry, Logan. He was a way better actor than he was, but he did write really good. And he had such a passion for film that we always saw things as a movie. Like we would be somewhere, and like tonight, and he'd be like, "Oh my gosh, this would be a great scene in a movie, Mom." And that's how. So we had this connection. Exactly. And you brought up something. When you say, "How do I heal?" I had the connection with my son that some people don't have with their living children. So I have to feel blessed that Logan was in my life for the short time that he was. And it was an honor to be his mother.
Yeah. Can I ask, do you carry him with you? And if so, how?
He's always, always, always with me. And, sometimes I have jewelry, but most of the time, it sounds so corny, but he's in my heart. And I think about him every second of every day.
Wow. I'm so sorry that you experienced this. I'm grateful you're using such a tragedy to do so much good, but I'm genuinely so sorry that we've crossed paths because of this. Liza, we're coming to the conclusion of this conversation. I have sort of a concluding question for each of you, but I am curious what role organizations like Retreat Behavioral Health can play in this fight. I mean, obviously, we're bringing hundreds of people out tonight from our community and beyond, and you've come from Canada, and we've got people here from New York and elsewhere that are with us this evening to really, I think, come to a place of understanding about what they can do and the gravity of this. But what role can organizations like Retreat play? You work at Retreat, obviously, in addition to working in private practice. So what can groups like this do to positively contribute to the solution?
Continue exactly this. I think at some point we're going to turn the camera and you're going to see what's happening behind the scenes here, and just community events, coming together as community partners, the behavioral health community, everyone just joining hands and focusing in on something that is so important. I think we have the bandwidth to work together, and the more we get out there and educate, the more people are going to want to join forces. And so I think that's important. I just have to say that you sat up here with such poise and grace and strength and resiliency, and so I appreciate you and thank you so much for sharing that. And I think everybody needs to hear this. We could all be out here doing this, but it comes from you, those true stories.
From hearing from someone like Marlyse, if people are wondering if their story matters, if they have sort of I don't want to, it's almost like a survivor of grief, but a survivor story, or a story of someone who's been through this and getting out there. What kind of impact does that have on people in terms of either getting to a place of healing or coming forward and asking for help in dealing with their own battle with substance use or whatever it may be?
Yeah, it has a significant impact on so many levels, and the fact that you're able to sit up here today and share your story of strength, right? And so other people seeing this know that they're not alone, that there is hope, there is somebody to reach out to, and also just recognizing, where to turn, when to turn. Yes, I just can't. I can't even imagine. And so I think it's important to recognize that.
Yeah, and I guess in conclusion, I'd love to know, Marlyse, you're involved with the Fentanyl Awareness Coalition, and that's a group that Retreat is keen to continue to support and get behind and to share and amplify the message of your group. But tell me about the work your group is doing, and in conclusion, what organizations like FAC can do to positively impact this fight and hopefully get us to a place where the numbers start to come down. Tell us about the work you're doing and the magnitude that it has.
Yes, we are all about building awareness and letting everyone know. So in fact, tonight you will see I created a commercial. And it's about, one pill, one time. In this instance, we have a bunch of these commercials that we want to, our PSA, that we really want to have full-on exposure to all through social media, so that people can see this and an unsuspecting person can go, oh, what one pill, one time, what's going on? Something that really captures you. Yeah. And so I think it's all about talking about exactly what Liza said, is really this involvement. This is a wonderful, Retreat has done an amazing job. This place looks beautiful when you see it. Right. It's gorgeous. And FAC is just so honored to be here and allow us to speak about the true dangers that fentanyl could be in your home. And that's scary.
Yeah, that's very scary indeed.
Marlyse
Williams, I want to thank you so much for joining us. Liza Piekarsky, a licensed mental health counselor, thank you for being here. And we want to thank you. Before we go, we want to show you this amazing space here on Facebook Live for Retreat Behavioral Health. So we're going to spin you around. And let's just take a look. The room is filling up. We anticipate several hundred guests joining us over the coming hours for this vibrant discussion about fentanyl and how we can work together to solve the problem. The goal over the next 3 hours, as you see, is to bring everybody together to ask questions. We're going to take live questions from our audience. We're going to hear from experts and people like Marlyse sharing their powerful story, and we want to continue to hear from you. So how can you get involved in this effort? You can head to our website, retreatbehavioralhealth.com. You can email Retreat. You can leave comments here on Facebook, and we will do our absolute best, our level best, to get you answers from experts. And you can reach out to us this. If you are in a community where you don't know if there are trusted resources, and the great people at Retreat are going to try and help you find those. So here on Facebook Live, coming to you from Palm Beach County, Florida, I'm Rita Alexander. Thank you for joining us this hour. Get involved with the fight. Check out the Fentanyl Awareness Coalition, and we'll see you next time. Thanks for joining us.